workshop for medical and dental school. I'm so glad that you joined me today. For those of you that I haven't met yet over Zoom or in person, my name is Lainey Flynn, and I'm the Assistant Director for Health Professions Advising. So I work with Cindy, and we both do the health professions advising for career ed and help those of you applying for medical and dental school. So this is one step along that process. And so I wanted to treat this as a workshop today so that you could kind of jot some things down, get some ideas going if you haven't yet already. I know a lot of you have already met and thought about personal statements and met with us, and that's fine too. Whatever stage you're at in this process, this is going to be beneficial to you because you always want to go back. You always want to reflect. You want to keep this as a working document until you really feel like it's perfect and ready to go to medical or dental schools. So first thing, I just want to start by reviewing with you what the personal statement is. So you already know this information, but it's nice to always zoom out, right? And take a look at why are we doing this? What is our goal? Reminding ourselves of the primary objective so then we can focus in on the details. So every medical and dental school you apply to gets the same personal statement, right? So you're just writing this one personal statement as part of your primary application. So in a sense, it's general, right? It's not specific to each school, but then it's very personal to you and why you want to be a doctor or a dentist. When secondary applications come, then those are unique to each school. So those questions will look a little different and you'll be a little bit more school specific, but that comes later in the process. So just a little clarification there. And as you know, the main goal of the personal statement is to answer the question, why medicine? Right? Or why you're going to be a dentist. So that is the main question we attempt to answer. It's good and bad to have such a big, broad question, right? Because it can be really hard to get started and think about all the details that go into why medicine for you, right? But also having a big question like this leaves it very open for you to get creative, get personal, and kind of share what you feel is most important. And so there is a lot of good that comes along with that kind of like big general question. And of course, we want to show the reader a little bit about who we are and to be as personal as possible. A lot of times as you're writing, we kind of get like bogged down in our examples and being specific with our experiences, and we kind of get into this flow and we tend to think about what does this look like for our reader, right? So we want to remember that there will be multiple eyes on this, on the admission side, and we are writing for those folks to be able to read. And so that's another reminder that it's really good to have many sets of eyes on your drafts, right? So as you're drafting this, having Cindy and I look at it is awesome. Having your faculty advisor look at it and others, that's going to give you that reader perspective. What are they seeing that maybe you're not seeing that is part of your personal statement? So how do you begin? This is kind of like the hardest part. And again, you're all probably at different stages of this. Maybe you're like, I haven't started yet. I'm stressed out. Maybe you have a full draft, and that's okay. Whatever stage you're at is fine right now. But it really is the hardest part to just start, because a lot of this starts with just brainstorming and getting ideas out there, getting examples written, even if you're not going to use them, right? But just putting things down on paper so that you can kind of sift through them and figure out what makes the most sense to include in a personal statement. So that's the biggest thing I would encourage if you're at the very beginning stages, is even if you don't know what you want to include now, just start writing. And then going into the process knowing you're going to make many drafts. Some students have already shared their personal statements with me, and I mean, we've already gone back and forth 4 or 5 times, and we'll continue to go back and forth via email. It's a long process, and it should be, because we want it to be the best possible personal statement. And for that reason, you're going to have many, many drafts, and you want to go into it knowing that, that your first is not going to be your last. Any questions so far? Let's see. Okay. And feel free to use the chat, and I'll try to navigate all of it at once. Okay. So let me move this up here. The first thing we're going to do today is we're going to start with a brainstorm. So again, I know you're at different parts in this process, but I still want you to go through these exercises. So we're going to spend a moment thinking about that big question of why you want to be a doctor. So I gave you some follow-up questions here, because not only do you want to answer why you want to be a doctor, but you want to think about experiences that led you to medical school, events in your life maybe that have been challenging, or obstacles that you've had to go through to pursue this path, any experiences or important people in your life. So all of these follow-up questions kind of help fill in this big question of why you want to be a doctor. So we're going to take, you can see my little 15-minute image there. We're going to take 15 minutes to work on this, but before we do so, I want to show you some examples of what you might think about when you're saying, why do I want to be a doctor, right? So maybe you want to serve your community and there's a lack of healthcare providers who represent your community members, right? Maybe you want to use your engineering background. So thinking about a unique major you have, right? And solve problems. Sorry, I was admitting somebody. Help patients by solving physical challenges they're experiencing, right? Maybe you have a lot of research. Research has like been your focus at Wellesley, right? So you want to take your research skills with patient input and provide the best care possible. So these are just some examples of like different directions you might go based on all of these experiences you have. So taking it a step further, after you're typing up or writing down these ideas of why you want to be a doctor, why you want to be a dentist, and it doesn't have to be anything pretty, right? It doesn't have to, you can just jot it down real quick. You can type it up. It doesn't have to be grammatically correct, anything like that. This is the brainstorming process. So just throwing things out there. And in this 15 minutes, as you're kind of writing that up, I want you to think about, okay, and now how do my experiences match with my reasoning, right? And we'll talk more about that after the brainstorm. But if you kind of start to put down some things into writing, I want you to start adding experiences to that. Like, okay, this time I volunteered, that's supporting evidence of why I said I want to be a doctor or I want to be a dentist. Any questions about the first brainstorm? Okay, so feel free to keep writing, about 10 minutes. But I want to kind of move forward for those of you that are ready. So we've begun the kind of brainstorming process. Anybody have any questions, things that they're thinking or wanting to share at this point? Just feel free to speak out. Okay, so hopefully you feel like you were able to get some ideas down, or check back at what you've had for a draft and being able to say, do I have that question answered in my draft of why I want to be a doctor? And then taking a step further now, we're going to try to add some supporting evidence to that. So one of the things we want to look for when we're looking and creating a personal statement is a theme. So the best personal statements have a theme that kind of weaves throughout the entire personal statement, right? From the introduction, the beginning, through the body paragraphs and conclusion, a continuous theme. So what I want you to do is take a look at what you've written down so far and check to see if you can find a theme. So do you see similar topics coming up? Do you see similar words coming up? Healthcare access, is that something you write about a lot? Research, is that something you list a lot? underserved populations. Is that something that you're seeing come up? So look for some words, look for some ideas, and see if you have a theme, right? Eventually, this is something we want. If you don't have a theme yet, that's okay, right? So continue brainstorming. We're going to continue writing, and it will eventually evolve. Okay. And at this point, you can kind of circle maybe important components to you until kind of that theme comes through. So when you're thinking about theme, here's an example for you. So for example, if you're a student that had volunteered at the Ronald McDonald House and did research on pediatric cancer, so you're seeing these different things. An overall theme might be your interest in scientific and humanistic sides of working with child patients. So that's just an example of like a big theme that you see throughout a personal statement. So just take a second here. I know I have 5 minutes on the clock to go through and you can really just highlight, right? If you're on your computer, circle if you're taking notes, some type of theme throughout. All right, so we're going to move forward. So you've had some time to brainstorm, to think about why doctor and if there's a theme emerging. And now we're going to write up some supporting evidence. Okay. So again, if you've already written up a draft of your personal statement, now you're reviewing it to make sure you have supporting evidence. So what this means is you want to think of some experiences that support this claim of why you want to be a doctor, and also weaving in that same theme you've been thinking about. So that could be so many different things, right? So some students will write a story about a shadowing experience with a patient that was really impactful for them for one reason or another. Some students will write about a research project they worked on that changed their perspective of a certain type of medicine or health. Working with different diverse populations that may have changed the way you look at the healthcare system, right? So think about what you've done, some of those activities you've completed over your 4+ years, right? And all that hard work you've done. And you want to come up with a few examples that will be on your personal statement that will support your reasoning for wanting to be a doctor or a dentist. So this part is another one that takes some time, right? So I know I have 10 minutes on the clock here, but this is certainly something that you're going to be working on and will be an ongoing process. But I do want to give you some time to write out, jot down, and ask questions about these experiences. So I'll do 10 minutes here on the clock. And again, if you have questions, you can put them in the chat. If you're reviewing your current statement, going through and seeing, okay, I wrote these examples. Do these match up with my initial statement about why I think I want to be a doctor or dentist? And do these match up with my theme? Or could I come up with maybe a couple more and see what fits better? It's always good if you have more to work with, right? So then we can pare that down and say, oh, that one doesn't really make a lot of sense for this. This one makes better sense to go on your activities and your application. So it's good to have a lot to work with, so you can always add and take away as needed. So remembering that this is a draft and a working document. Great. All right. So good questions in the chat. Hopefully getting started here in the process. So like I said, this is really a work in progress. So, and this is intended to get you thinking kind of like big picture down to some details, but really it just now is about writing, right? So beginning that writing process. As I said to a few folks in the chat, I would love to see personal statements. So once you feel like you have a first draft, and again, you don't have to feel like you have to have a spectacular final draft to send it on to Cindy and myself. Just sending over your first draft and allowing us, if you can make it like a Google Doc that we can look and add some comments on the side, that's helpful. So it can be a work in progress. That's great. I mean, that makes a big difference because we are able to really look at yours specifically. One of the things that we won't do today is I won't show you examples of personal statements. You can certainly find them online, Google them and find many. But, you know, the trouble with looking at other people's personal statements is it may influence your writing in a way that kind of takes away from what's really unique to you and what you want to focus on. And you don't want to take someone else's ideas and say like, oh, that's good, I'm going to focus on that as well. You really want to focus on ideas and topics and examples that are unique to you. So we really don't use examples when we do workshops, and that's intentional. So I would rather have you kind of get these ideas out and like let us have a look so we can kind of go back and forth in the brainstorming process if you're feeling like you're getting stuck. So any other questions right now? So a few things I want to mention as well. So as you're writing your personal statements, you want to make sure they're organized, easy to follow, clear and concise. That's a big one. Sometimes I read students will write examples of maybe a time they shadowed a patient or they had a research opportunity, and they become really lengthy, giving a lot of details, which is great, but you want to be as detailed and as concise as possible. Because again, you don't have unlimited words here, right? You want to make sure that you're writing something that the reader can easily read and quickly read, right? So following our theme, right, and be completely clear of errors. So this is where proofreading comes in. You want to make sure that you're having as many eyes on your draft as possible, because you want to turn in a final draft that has no grammar and no spelling errors at all. That should be number one, something that is definitely clear. So what personal statements shouldn't be? So we want to stay away from generic themes. I know that's hard to kind of conceptualize sometimes. So definitely check in if you're wondering, like, is this too generic of a theme? But you do want to stand out as an individual. And even if you're here thinking, you know, there's nothing really about what I've done that I feel like stands out or makes me unique, there probably is. We just have to do some more brainstorming around the experiences you've had, your background, the way that you think, to come up with something that's meaningful for you. And Cindy and I can help with that if you feel like you're getting stuck. But we want to try to be as personal and less generic as possible. Another thing you want to try to avoid is using quotes. So sometimes people think about like inspirational quotes or things like that they want to pull into certain writing pieces, and this usually isn't the place for that. Try not to focus on the negative. So sometimes students will write things that they do not yet know, right? Or things that they don't have yet. And even though that may be true, you want to stick to the positives. So what you can bring, what you do know, what you have learned. And that goes for when you're speaking about like medicine and healthcare more broadly. So we know that there are some negative parts about the system itself, but when we're writing our personal statement, we really want to focus on the positives. And even if that means like a positive change you want to bring to the system, but trying to stay away from any kind of like negative connotations or anything around that. So personal statements cannot cover everything. So there's so much we want them to know about us, right? So you kind of want to talk about everything, but you really can't. And so that's why we want to try to take the time to brainstorm and think about the things that make the most sense in our personal statement. And then the other pieces we leave for other parts of our application, right? So keep in mind that you have the activities section, and then you have these secondary applications where you're going to be writing more specifically for the school. So you will have other opportunities to write about other things that maybe won't fit or don't make as much sense in a personal statement. And then you don't want to talk about anything that could be open to misinterpretation, right? So sometimes leaving something so open that it confuses a reader, right? Or talking about maybe controversial topics, that can sometimes hit or miss depending. So it's best to stay away from that. And remember that the people reading your personal statements are going to vary a lot in age and demographics and diversity. And so you want to provide a personal statement that can be read clearly and understood by anyone, right? By anyone that would be on a missions committee reading your statement.